Case number 3, impression. T1, T2 hypointense lesion attached to or adjacent to the distal supraspinatus tendon most likely represent calcified tendinitis. So what is calcified tendinitis? This is a calcified deposit here. So anytime any muscle or any tendon is calcified, it's going to cause more tear, going to cause more tendinitis. Tendinitis means inflammation of the tendon as well. Okay, so this is also one of the supraspinatus tendon calcification as well too. Okay. In addition, heterogeneous signal in the distal supraspinatus tendon suggests chronic rotator cuff tear or severe tendinopathy. There is a large subdeltoid effusion noted. Okay, so what is subdeltoid effusion? So this is a deltoid muscle right here, look at that. Okay, when you open up the deltoid muscle, there's a lot of water collection or water effusion is under here. That's called subdeltoid effusion. It's very, very common. Now again, deltoid, if you move your arm up this way and it's caused severe pain, then we know deltoid tendon has been torn, has been damaged as well too. Okay. Now let's go to the bursa. Now there is a lot of bursa in the shoulder. You can see subcoracoid bursa here, subacromial bursa here, and subdeltoid bursa right here. Whenever the shoulder come up a lot, the bursa is going to be growing, like we talked about, growing against the bone. The bursa is going to have damage, and the bursa will, when there's damage, the water within the bursa is like a water sac, it's like a water balloon. Have you played water balloon before? Right? If you give too much pressure to the water balloon, it's going to burst, right? So it's kind of similar. So once the bursa have tear, the water is going to come out. It's going to create effusion and edema to the shoulder area. Okay, same thing as this one here too. Okay, and the function of the bursa again is to protect, is to give cushioning to the muscle and the tendons of the shoulder, so they will not be easily grind. The tendon will not be easily grind. Tendon will not be easily torn or tear. Okay. Now we are going to talk about different possible causes of shoulder pain. There is a lot of shoulder pain causes. Okay, let's go ahead and discuss each one of them in detail. Inflammation. Almost 80% to 90% of the patients that come to me, they all have inflammation. And we talked about inflammation in the previous slide. We talked about it. Inflammation caused by what? Tear. Inflammation caused by torn tendon, torn muscles. Inflammation caused by torn bursa. Inflammation caused by overwork of the shoulder. Inflammation also caused by different diet. If you already have torn, if you already have damage to the shoulder, and if you eat sugar, if you eat sweets, if you eat nightshade vegetables, the inflammation is going to increase. The inflammation is going to get worse and worse, and shoulder is going to get worse. And if you have a lot of inflammation, if you do not take away the inflammation, and you only go to the physical therapy, and they give you exercises, they give you ultrasound, and they give you stimulation, it's not going to help, because ultrasound, stimulation, exercise does not take away inflammation. And if the doctor give you NSAID, cortisone, anti-inflammatory cortisone drugs, That drug in itself, it's not enough to take away the inflammation. It's just not enough. I've seen way too many patients taking the NSAIDs, the anti-inflammatory drugs, just don't get better. Yes, but for the beginning, if your symptom is minor, if your symptom has not been there for years, yes, medication will help for acute cases, definitely, no doubt about that. But for chronic years and years of pain, medication is not going to help because they're simply not strong enough. And also the pain of the shoulder is caused by so many different layers of problems, so many different layers. If you only take away the inflammation, if you do not take away other layer issues of the shoulder, same thing, your shoulder is not going to get better. So again, inflammation is only one of the inflammation. It's only one of the layers. It's only one of the reasons why the shoulder has pain. For maybe 20% of the patient's shoulder pain, once we take away the inflammation, the pain is greatly reduced. But that's only 20%, 30% of the patients. We talk about sugar being a huge player in causing inflammation. I'm going to show you a video how sugar causes inflammation in the shoulder, how shoulder affects the shoulder so it will not heal, how shoulder interfere with the healing of the shoulder. Please go and see this about a few minutes clip, and after you saw it, I'm going to explain more to you.